In March 2020, when the COVID-19 pandemic hit our shores, I was 20 years old, a student social worker on placement in a hospital. But, as tends to be my luck, this wasn't just any hospital. It was also the hospital that had the first confirmed case of COVID-19 on this island. We can all remember from January onwards, watching the news coming in from abroad of lockdowns, hundreds of cases, but thinking that was miles away. That's never going to happen to us. But by the end of February, it was here. Not many of us would have believed that the words quarantine, social distancing, and self-isolation would soon become part of our daily vocabulary. It's not easy to think back on what those days in the hospital were like. Just like everyone else in the world, there was this scramble to figure out how to respond to a looming global emergency. But unlike everyone else in the world, my colleagues in the hospital were expected to know what to do about it. Even I was suddenly regarded as some sort of expert among my friends. Katie, she works in a hospital, she knows what's going on. But he had to break it to you folks, unless you couldn't already guess. I didn't really have access to the UK government emergency meetings about the pandemic. My response when I was asked, and I said this repeatedly with a ridiculous amount of unqualified confidence, if the doctors I work with aren't worried, then I don't think we should be worried. But that advice quickly changed, and I remember the day it changed, the 12th of March. Dreary Thursday that seemed to be just like any other. I rolled out of bed, grabbed my morning coffee, walked to work, where I started my day with patient updates on the wards. It was there that I saw the first signs that the doctors were beginning to worry. One of the top consultants, a glamorous but terrifying woman who could kill you with one stare, normally walked around in ridiculously high heels in long dresses. But I saw to my shock that morning that she had her hair tied back in a knot, that she was kitted out in scrubs, and she looked like she was carrying the weight of the world on her shoulders. Another doctor was suddenly walking around wearing a surgical mask, which freaked us all out because that was not normal on the wards at the time. And the rumor whisked around that it was because he had developed a dry cough that morning. Social workers in the emergency department were being sent for fit testing, which is where they fit you for a respirator mask. And families we worked with, worried by the constant news cycle and social media rumors, began asking fretfully if their relatives would survive if they caught the coronavirus. A question I never in my life thought I would be asked, and a question I had no idea how to answer. I checked my phone in the afternoon to see news coming through that schools in the south were being ordered to close, followed very closely by a message from my younger brother with the words, 2 weeks off school? Happy days. In the days that followed, news began filtering through about students on health and social care degrees. Final years were being asked to graduate early to help the workforce during the pandemic. Student doctors got the call first, then student nurses and midwives. And it felt like this dreaded game of spin the wheel to see when we social work students would get the call. St. Patrick's Day rolled around, a day I had never before in my life spent without my friends and family in Monaghan. But this year, instead, spent sitting forward on the sofa, watching the Taoiseach address the nation from DC, explaining how we must work together to flatten the curve. And that's when it sunk in. With a heavy feeling on my shoulders and tears streaming down my face, I knew in my heart that I wouldn't be seeing my family or my home for a very long time. As expected, my social work placement was cancelled the very next day, and just like that, my university experience was over. Done. Me and my housemate got home at the same time that night. We cracked open a bottle of wine, and we laughed, and we danced, and we cried, because there would be no final year formal, no late-night library rush, and no glamorous graduation. We were just two 20-year-olds who thought we knew everything, suddenly reduced to knowing absolutely nothing. The next day, we said goodbye. She moved home to be with her family, and I went to work that evening to start as a full-time social worker working with children with learning disabilities. In the space of just a few short days, I felt as though my entire life and the entire world around me had turned upside down. All my hopes and expectations for the coming months were crushed, reduced to dust, and I was left completely alone, feeling lost, hopeless, and terrified for what was to come. But the overwhelming emotions I felt in those days were by no means unique to me, and I'm sure every single person in this room right now can relate to the uncertainty, worry, and unease that came with navigating the early days of the pandemic. It was weeks before we could come to grips with the sudden and vast shift to our lives and routines. Thousands of people lost their jobs, and for those who were still working, it was under the vastly different conditions of working from home. We feared for our loved ones, and we grieved for those we lost. Our social lives were reduced to screens and endless Zoom quizzes, and we craved the days where we could safely give each other hugs. Data tells us too that traumatic time in our lives has had a profound impact on our mental health and well-being. The periods of isolation, reduced social contact, fear, anxiety, worry, grief, uncertainty, financial instability have all had a devastating effect. When we look at this room now, a room of about 100 people, approximately 5 people in this room before the first lockdown would have had a diagnosable anxiety condition. By the end of that first lockdown, that number will have risen to 31 people. With services shut down or operating with reduced capacity during the first wave in particular, there was limited early intervention work able to take place, and it's widely believed that we'll see the impact on our mental health and well-being for years to come. The pandemic for many of us created a pause, a silence, a halt, and whether we wanted to or not, we were forced to reflect on our own lives, our priorities, and what matters most to us. As we asked, will life ever be the same again? We slowly but surely began to shape our new normal. For the young people I worked with, their lives had been turned upside down just as much as the rest of us. Reduced family contact, schools closed, local travel restrictions, and our job was to create as much normality as humanly possible in the midst of global chaos. And I can tell you, some of those lockdown months living alone, working with those young people, have taught me more than my degree ever did. Sorry, Queens. Even in the darkest times, those young people could find fun and joy in absolutely everything. In the confines of the restrictions, we truly had to go back to the basics. So one of the things that I always did, every chance I could, was to take them to the local, quieter parks where there was plenty of space to run around with minimal risk of COVID. And let me tell you, there was no purer joy to be found than one day I took one of the young people out, this lean, lanky, 6'2", 16-year-old to the park, and I could hear him squeal with delight when he found a patch of daisies and dandelions in the long grass. He insisted he decorate my hair with them, so I got home on the train that night with my heart full and my hair looking like a bouquet. Having to live alone too forced me to work harder to break out of the lonely bubble I found myself in. So multiple times a week, I would hop on video calls with a group of friends. We'd gossip, have a few drinks, play some games. And one night, we made the decision we'd all get dressed up in our nicest clothes, as if we were going to a formal. So yeah, picture this. Me in my long formal dress, with my hair curled, lashes on, nails done, holding a glass of Prosecco, but not in a fancy hotel, sitting on my sofa in a damp, cold student house. I know what you're all thinking. At any other time in my life, I probably would have called that pretty pathetic. But looking back on 2020, it was probably one of the happiest memories I have of that year. We still do the group calls quite regularly, just without the formal dresses. I love getting regular updates from my family and friends back home too. Messages, calls, parcels, even letters. Yes, handwritten letters. I didn't even know those still existed before 2020. It was lovely to see what everyone was getting up to, but if I can be absolutely brutally honest with you, the video I got sent of my mother doing a TikTok dance is not something I will ever be able to unsee. I also met my neighbours for the first time. Like, yeah, imagine a Gen Zer chatting to strangers. When they learned I was living alone and working in social services, they went out of their way to help from a safe distance. They rediscovered baking during lockdown and brought me portions of everything they made. They too, probably like most of you in this room, had a banana bread phase, and I personally really enjoyed it. So over time, and with the help of those incredible people around me, I came to understand that worry and fear can exist side by side with happiness and joy. Not as a contradiction, as I had previously believed, but as necessary partners. In this post-pandemic era, we've moved swiftly back to normal and forgotten the new normal we all came to know. Masks are gone, public transport is once again at full to burst capacity. And the saddest part for me is I can no longer get free coffees with my NHS staff card. The lessons I've learned from this time, though, have provided a foundation for almost everything I've done since. I was elected as Student Union President with the message that mental health matters, and whether it was supporting individual students or launching mass campaigns to start conversations about mental health on campus, providing virtual spaces for students to meet and make friends, or crucially, lobbying our government ministers to provide much-needed support for students. The question at my core, driving me forward, has always been, what can I do to make this campus, my small corner of this big, scary world, a happier place? So, with that, I want each and every one of you to ask yourselves this. What lessons did you learn during your new normal, and how can you use that to make your world a more joyful place? Gormila Maigov.